Okay, so we're starting this one off with a real puzzle. Imagine a country that has this incredible high-tech system designed to protect its farmers, but in one state, all the critical data has just vanished. And look, this isn't just about numbers on a spreadsheet, it's about people's livelihoods. We're going to dig into why this data is missing and what that actually means for thousands of people on the ground.
This one question right here gets to the absolute heart of the mystery. You see, India has this really sophisticated national system for tracking animal diseases. So why is it that when you look at the state of Meghalaya, the data is totally invisible? It's like a black hole in the system. Let's figure out why.
All right, so before we dive into the mystery, let's talk about the promise. Because on paper, India has a really impressive national system set up to protect its livestock and, of course, the farmers who depend on them. This is how the whole thing is supposed to work.
And honestly, the national toolkit is pretty impressive. You've got things like NADRES. That's the National Animal Disease Reporting System, which basically acts as an early warning signal. It can send alerts about 15 major diseases, like directly to a farmer's phone. And that's backed up with dedicated funding for outbreaks and a whole formal crisis plan. So in theory, it's this robust, multi-layered shield.
And we're not just talking about plans, right? There's serious money behind this. We're looking at over 196 crore rupees, and that's just for 1 year to fight one disease. So the funding is there. The national commitment, it seems totally real. The promise of protection is backed by some serious cash.
So that's the national promise. It sounds great, but when we zoom in on the state of Meghalaya, well, the reality on the ground is completely different. This is where our story takes a really sharp turn.
So you go looking for answers, right? You go to the official state veterinary website. You're expecting to find hard data. And what do you find? Photo galleries. You find pictures of celebrations, of plantation programs. Now, these are perfectly fine events, but where's the critical data on disease outbreaks? Where are the vaccination numbers? It feels like it's all ceremony, with no substance.
And here it is. Here's the disconnect, all in a single frame. On one side, you have the national promise, early warnings, crisis plans, major funding. And on the other side, Meghalaya's reality, photo ops, and a complete, total data void. The contrast is, well, it's stark. And frankly, it's pretty alarming.
Okay, so let's just try to answer some basic, really crucial questions. I mean, if you're a farmer there, or even just a concerned citizen, this is the first thing you'd want to know, right? Just a simple number. How many outbreaks were there last year?
And the answer, according to all the publicly available data, is nothing. There is zero information out there to answer this most basic of questions.
Okay, let's try another one. How many animals actually died from diseases that we literally have vaccines for? This is such a key metric. It tells you exactly how effective the veterinary response really is.
And you guessed it, silence. No public data exists. We have absolutely no idea how many farmers lost their precious animals.
All right, one last try. Let's look at the prevention side of things. What percentage of the state's livestock has actually been vaccinated against these major diseases? I mean, this is a core performance metric for any veterinary department anywhere in the world.
The answer is exactly the same. Nothing. It's a complete and total information blackout. You can't assess the problem, you can't assess the impact, and you certainly can't assess the prevention efforts. The entire system in Meghalaya is just a black box.
So what we have is a lot of celebrations on one hand and a total lack of data on the other. But this isn't just about, some numbers missing from a website. This data gap has serious, real-world consequences for real people.
See, this lack of data creates a really dangerous domino effect. It all starts with secrecy. When that critical data is hidden, farmers, well, they can't assess their own risk. They're flying blind. And when farmers are left in the dark, the public can't hold the government accountable. And when there's no accountability, any policy failures, like, say, delayed vaccinations, they just remain completely invisible.
But, it's not enough for us to just point out the problem. There is a way forward here, and it really starts with empowering citizens, empowering you to demand some answers. So, what can we actually do about it?
This right here is basically a roadmap for accountability, and it starts at the local level. You can ask your vet about local disease reports, you can go and verify vaccination rates at your nearest dispensary, and most importantly, you can demand that the department publish its data quarterly on outbreaks, on vaccinations, on mortality rates, and on emergency response times. This is how a black box starts to become a transparent system.
And that really leaves us with a final, much bigger question. We've focused on livestock data in just one state, but think about it. If this vital information can just disappear, what other critical public data might also be invisible? What aren't we seeing when it comes to other essential services? It's definitely a question worth asking.